Hi, I am Dr. Abhinav Sharma, Senior Consultant, Pediatrics and Neonatology, Cloudnine, Gomti, Nagar, Lucknow. All the babies have to be protected from the direct effect of the sunlight. Sunlight may contain certain harmful radiation that may include ultraviolet rays or the infrared rays, which may harm the skin of the newborn baby. But can we use sunscreen in the babies? Normally, sunscreens are not recommended in babies less than 6 months of age. The sunscreen available in the market are of two kinds. There are chemical sunscreens and there are mineral-based sunscreens. The chemical-based sunscreens, when absorbed into the baby's body, contain certain metabolites that may not be metabolized by the baby. And the mineral sunscreens, they tend to form a barrier effect on the baby's skin and prevent absorption of the sweat, and that may prevent the absorption of the sweat and that may lead to difficulties with temperature regulation. But if at all a sunscreen has to be used, then we should prefer using mineral-based sunscreen, and these in the small babies. These mineral-based sunscreen are either zinc or titanium oxide-based. Whenever choosing a sunscreen, you have to use a broad spectrum sunscreen that protects both from ultraviolet A and ultraviolet B radiation. Choose a sunscreen which has a sun protection factor of at least 30 that may block at least 97% of the UV radiation. The sunscreen may be available either in cream, gel or the spray-based forms. Cream or gel-based formulations are preferred over spray-based formulation, as the spray-based formulations cannot make a thick protective layer over the baby's skin.